पंचामृता फोर्टिफाईड राईस हातूंत आयर्न, झिंक, फॉलिक ऍसिड, विटामिन ए, बी सारकेले 9 मिनरल्स आसात. तर पुराय पौष्टिक आहारा खातीर
पंचामृता फोर्टिफाईड राईस
असल्यास पुरो.
पुराय पोषणा खातीर पंचामृता फोर्टिफाईड राईस. घराघरांनी पंचामृता.
नमस्कार. प्रुडंट मिडियाच्या हॅलो दोतोर कार्यावळीन तुमकां सगळ्यांक मना काळजासान येवकार. तुमकां येवकार दितना आज आमकां एका विशिश्ट अशा खाशेले जे आमचे अतिथी आसात, जे आमचे गेस्ट आसात, ते आसात डॉक्टर गौरी दिवाण, डायरेक्टर चायल्ड डेव्हलपमेंट ग्रुप संगत. संगत ही एक अशी व्हडली संस्था आसा जी भुरग्यां खातीर काम करता. ही संस्था कितें काम करता आनी दुसरें म्हणजे आयचो जो विशय आसा तो म्हणजे भुरग्यांच्या विकासांतलो कळाव म्हणजे चायल्ड डेव्हलपमेंटल डिसेबिलिटीज. ह्या विशयाचेर विस्कटान म्हायती करून दिवपा खातीर आमचे बरोबर आसा डॉक्टर गौरी. डॉक्टर नमस्कार, वेलकम.
नमस्कार.
त्यो खूब पयशेल्यान आयल्यात, तांकां आमी खरें म्हणजे येवकार दितना आमकांय खूब आनंद जाता आनी ह्या विशयांतल्यो तज्ञ अशें त्यो समजतात आनी त्यो तांच्या बद्दल एक आदर आसा आनी गोंयच्या ह्या तांची जी संस्था आसा म्हाका दिसता सगळ्यान पयलीं आमी ताचीच वळख करून घेवया. डॉक्टर, फर्स्ट ऑफ ऑल आय वूड लायक टू जस्ट आस्क यू वॉट द संगत डील्स वीथ एंड वॉट आर दीज युअर चायल्ड डेव्हलपमेंट प्रोग्राम्स आर.
Yeah, so thank you. That's a good question. So Sangath is now going to, in a couple of years, celebrate its 30th year. So we've been in Goa now for 30 years. And we started as a child development center. So we started as a clinical service where children were coming to us with, families were bringing their children to us, and we were supporting their needs in various areas, particularly with a focus on developmental disabilities. But around 15 to 20 years ago, we realized that there were reasons that families could not continue coming to us. And so we became a research organization. So we have become now what we call a research and implementation organization. And the idea is we are trying to understand what is the best service a family needs and how do we design what we call packages of these services which the government can then put in place. Because we know that the government is the best provider of care for our children and for adults also. So our aim is really to design, to evaluate and then to implement in our communities.
सो बेसिकली डॉक्टरान सांगला की सरकारच्या आदारान ज्यो भुरग्यांच्या विकासांतल्यो कळाव जावपाची जी कारणां आसात तातूंत कितें आमी बेस्ट सर्विसीस प्रोवायड करूं शकता लोकां खातीर. कारण हे एका दिसान जावपी इट इज नॉट लायक मेडिसीन की मलेरियाच्यो गुळयो घेतल्यो 4 दिसांनी मलेरिया गेलो, टायफॉयडच्यो गुळयो घेतल्यो 8 दीस टायफॉयड गेलो, अशें जायना. इट इज अ लॉंग टर्म प्रोसेस आनी ह्या सगळ्या प्रोसेसान घरांतलो सगळो जो कुटुंब आसा तें बाकीचे शेजारी पाजारी ताचे टिचर्स ह्या सगळ्यांक इन्वॉल्व करून आमी कशा रितीन ह्या भुरग्यांक बऱ्या रितीन मोर प्रोडक्टीव, मोर अफर्मेटीव, मोर पॉझिटिव्ह अशा रितीन तयार करून समाजा खातीर आनी देशा खातीर तितकेच प्रगत नागरीक तयार करूं शकता अशी एक व्यापक भूमिका दवरून संगत आज काम करता. म्हाका दिसता ऑलमोस्ट ताणें सांगली 25-30 वर्सां ती ह्या गोंयांत काम करतात. खरेंच तांचो वार खूब कौतुकास्पद आसा आनी त्या खातीर सगळ्या लेवलचेर म्हणजे गांवां पासून ते सरकारा पर्यंत तांचें एक बरें आदराचें स्थानय आसा कारण तांचें कार्य तशें आसा. सो डॉक्टर, फर्स्ट ऑफ ऑल लेट मी आस्क यू अनदर इम्पॉर्टंट क्वेश्चन की वॉट आर डेव्हलपमेंटल डिसेबिलिटीज विच यू कॉमनली एनकाउंटर इन गोवा.
So developmental disabilities, just the description of it, so there are two words which we are putting together. One is development. So it happens very early in childhood and it's a disability, which means it is impacting the way the child can interact with the world around them. So the common ones that we have found are sensory motor, so things to do with hearing, vision, to do with movements. The other one is thinking. The third is socio-emotional. How do we relate to people around us? And the fourth is language. So these are the 4 big buckets of developmental disorders and disabilities that impact young children.
सो बेसिकली ताणें सांगलां तें हांव मातशें कोंकणी ह्या खातीर सांगता की सगळ्या लोकांक कळचें म्हणून, कारण खूब म्हत्वाचो विशय आसा. सगळ्यां खातीर तितकोच म्हत्वाचो आसता की हे ज्यो भुरग्यांच्या विकासांतल्यो अडचणी आसतात त्यो तांच्या दृश्टींतल्यान आसूं शकता, म्हणजे तांच्या नदरेन प्रॉब्लेम आसूं शकता, तांच्या आयकुपाच्या लेवलाचे प्रॉब्लेम आसूं शकता, तांच्या समजुपाच्या लेवलार प्रॉब्लेम आसूं शकता किंवा तांचें कम्युनिकेशन म्हणजे लँग्वेज जे म्हणजे भाशीक लेवलाचेर जे ते उलयतात किंवा ते समजतात ह्या लेवलचे प्रॉब्लेम आसूं शकता. आनी ह्यो 4 प्रकारच्यो ज्यो म्हत्वाच्यो डिसेबिलिटीज आसात त्यो तांचें ऑर्गनायझेशन डील करता. त्या विशयांचेर कशें मात करूं शकता, कशा रितीन ते भुरगीं फुडें बाकीच्या भुरग्यां इतकीच प्रगत पद्दतीन विचार करून फुडें सरूं शकता हाचे खातीर पुरेपूर प्रयत्न करप आनी हे सगळें त्या खातीर करता. एक समाजाक बांदिलकी किंवा पेरंट्सांचो सपोर्ट किंवा बाकीच्या घरांतल्या लोकांचो समाजाचो सपोर्ट कशा पद्दतीन इन्क्लूड करूं शकता ही एक व्यापक भूमिका घेवन ते काम करतात. Doctor, one more important question I would like to ask you. What are the causes of this development? Because see, everybody we presume, see every child is born, okay, everybody is happy. But unfortunately, sometimes they'll end up in this type of problem. What are the causes of these developmental disorders?
So again, a very good question, and I think most disabilities, we don't know the cause. So I think that is one thing that we should be very honest about. But of course, there are some reasons. So for example, you will have children or a pregnancy which has been very difficult. A mother who may have had an infection, a very difficult labor period. So a mother who had to have certain medicines during a delivery. All of that impacts the growing fetus. So it impacts the growing mind. So this is one of the reasons that we can point out to developmental disorders. The other is genetics. Both from the father as well as from the mother, the child is getting equal amount of genes and chromosomes, and that can impact the development. So often in developmental disabilities, we can see a family history. So you can see that this particular child might have quite a severe disorder, but when you look at the generations above, you may see milder levels of that disorder. So there is a genetic propensity for certain disorders. And I would say these are the most common. Of course, you will also have early childhood infections. You might have toxicities. We have some communities in India, luckily not in Goa, where we have things like lead in well water, which can impact the brain growth of children. So there are multiple reasons, and often they're very specific to the communities that we live in.
अच्छा. सो परत हे सांगताना इम्पॉर्टंट महत्वाचा जो मुद्दो आसा तो ताणें हे सांगला की दॅट वे इफ यू कन्सिडर इज रायट फ्रॉम द कन्सेप्शन. सो कन्सेप्शन कशा पद्दतीन जाता आणि तेन्ना पासून जर समज कितें प्रॉब्लेम आयलो म्हणजे गर्भधारणेन प्रॉब्लेम आयलो किंवा गर्भाक प्रॉब्लेम आयलो किंवा समज पेरंट्स जसं ताणें सांगलें जेनेटीक प्रॉब्लेम आसूं शकता. ह्या सगळ्या कारणांक लागून त्या भुरग्याक जे भुरगे जन्माक येता ताका कितें तरी प्रॉब्लेम येवं शकता किंवा ताका कळाव लागू शकता डेव्हलपमेंट जावपा खातीर इन कंपॅरिजन विथ अदर चिल्ड्रन. आणि हे सगळें करतना आनी एक म्हत्वाची गजाल आसा केन्ना केन्ना त्या भुरग्याकूय कितें समज जन्माक आयल्या उपरांत भुरगें नॉर्मल जन्माक आयला शकता, पण समजा म्हाका मागीर ताका कितें एक समज कितें इन्फेक्शन जालें, कसलें ब्रेनाचें इन्फेक्शन जालें किंवा जशें तांणी सांगलें की लेड टॉक्सिसिटी म्हणजे एक लेड जो गोंयांत चडशें अशें प्रमाण दिसून येना कारण तितकें आमचे कडेन तितक्या म्हणजे तितक्या प्रमाणान लेड वापरनात आनी तितके म्हणजे आमचे पायपांनी जे आसतात ते चडशे त्या लोकांक जाता ते. So सुदैवान गोंयांत ना. So and another important question is like what are the commonest development disorders you encounter in otherwise in the community? I'm not talking only about Goa. If you compare with other communities.
So we were quite lucky. We were part of a national screening and detection program which was done in 2012, 2013. And what we found there was the common was hearing impairment.
Oh.
Due to infections usually. So that was very common. The other one, which is relatively very common now, is intellectual disability. So the ability to think, to reason, to learn new things, that's often quite common. One thing that we're seeing more commonly now, which is what we're trying to address through a program we'll talk about a little later, is a disability called autism.
Oh.
So that is something we're recognizing more and more. I don't think it is increasing in numbers dramatically, but what is happening is we're learning to recognize it better.
Achha.
So because we have better understanding of this disorder, we're able to recognize this earlier now. So I think these would be the 3 or 4 disabilities that we are finding quite commonly. And let's not forget, I think hearing impairment, vision impairment are things which have been very stable in terms of their prevalence in our communities for many, many years.
So how common they are?
So usually 1%. So in total, we would say developmental disorders will occur in 12 out of every 100 children. And certain disorders are usually around 1%. So, and then when you pool them all together, so 12 children out of every 100 will have a developmental disorder. So it's very important for us as a community to realize that this is not a rare occurrence.
Correct.
Yeah.
सो तांणी सांगलें की 100तल्या 12 भुरग्यांक खंयच्या पद्दतीची ह्या पद्दतीची विकासांतली कळाव लागपाची प्रक्रिया दिसून येवं शकता. सुदैवान फॉर्च्युनेटली आज तांचे डायग्नोसीस अर्ली जाता कारण आज अशी मेथोडॉलॉजी लोकांक जागृत केली. देर इज अवेरनेस. People are aware, that's why they go to the concerned authorities, concerned doctors or pediatrician or psychologists, psychiatrists, whoever it is. So that's why they are diagnosed early. So आज हांचें प्रमाण जर खूब वाडलां अशें म्हणू शकना, पण स्टेबल जरी असलें तरी पण 12% ही बरीच खूब व्हडलो नंबर आसा. त्या खातीर सगळ्यांनी जागरूक रावप महत्वाचें आनी म्हाका दिसता ही जागृतकाय आसतना one more important question. See, sometimes what happens, we feel that a child is not listening properly or misbehaving or what you say, because you mentioned about one word called autism. So I would like to know what is autism, because as you have rightly mentioned, the number may be static, but it's quite problematic in a general population.
Yeah.
So I would like to just you to explain about it.
So I'll talk to that in a minute,
Yeah.
but also just to say that one of the things you talked about earlier in this sentence, which was very important, is that when children show behaviors that parents don't understand or the community don't understand, we label them.
I see.
So these are children that we call naughty, badly behaved.
Absolutely.
Because we don't understand why they're behaving in a certain way.
Absolutely.
Autism is definitely one of those conditions where we are mislabeling children. It's a very interesting disorder. And it's a disorder which can, we call it autism spectrum, because you may have on one side a child who has no speech, who is not interested at all in anything that's happening in their environment. And you will have another person who is like a little professor. You will have somebody who can recite poetry, who
Correct.
can learn things,
Absolutely.
but their ability to make connections with other people is very impaired. And that is what we call social communication. How do I make a relationship? How do I maintain a relationship? But most importantly, how do I start and finish a communication? So for example, when we met this morning, we said good morning, we shook hands maybe, we said namaste. People with social communication difficulties don't understand these behaviors. And so they might come in and immediately start talking to you, why are you wearing a white shirt today? And you will say, oh, that's a little odd. Why is this person behaving like this? But that is part of the disorder. It's the inability to have understood the nuances of how people behave in society and how that communication is started, continued, and completed. So these are two really spectrums of the same disorder.
So as you rightly said, की आमकां खूब फावटी दिसता की हो भुरगो मस्तेपणां करता किंवा हो मातसो अति सुबेज किंवा पेरेंट्स हैव नॉट ट्रेन्ड देम प्रॉपर्ली.
Exactly.
बरे संस्कार दिवंक ना. That's what we
Correct,
see because
correct.
we often parents busy असता तो आपल्याक जाय ते करता. He's behaving and they are in their own world. This child is
Exactly,
always in their
exactly.
own world. But as madam has rightly said की ह्या भुरग्यांक कितें तरी डेव्हलपमेंटल डिसऑर्डर आसूं शकता. हे मनान दवरून जे आमी ताच्या बद्दल एक लेबलिंग करता किंवा जजमेंटल जाता अशें जावपाक जायना. किंवा we have to be also be proactive in providing a strategy so that the child can overcome this problem and parents are supportive. हांकां सगळ्यांक बरोबर घेवन बाबा हाका कितें problem आसा. See, sometimes we are hesitant to say.
Yeah.
Actually, you have understood that this problem baby is having the problem, but you are reluctant to tell the parents की तांकां सांगपाक भंय दिसता की okay,
Absolutely.
they will not feel good. So he is very good because no, he can, as you rightly said, he is good in reciting poetry. ताका number कळटा, ताका poetries कळटा, ताका पिक्चराचे dialogue कळटा, but social communication, there is a big lag.
Absolutely.
And there is a miscommunication. So बारीक गजालींचेर सुद्दां लक्ष दवरप स्पेशली भुरग्यांचे हे खूब महत्वाचें आसा आनी ह्या दृश्टिकोनांतल्यान फक्त ताचो शाळेंतलो अभ्यास अशें न्हय, तो समाजान म्हणजे बाकी आपल्या पेरेंट्सा बरोबर, बाकीच्या भुरग्यां बरोबर, टिचरा बरोबर कसो वागता, कसो बिहेव करता, एवरीथिंग काउंट्स.
Absolutely.
Doctor, now you have observed a child and you have come to say as a parent, say I may say, okay, I have found that something is wrong or something is fishy, I can say. But as a doctor, how you will come to the diagnosis? Because I may say, no, he's that way is good, because as everybody says, no, that way he is very good, that way he is very good. So now how you diagnose this autism or any problem related to developmental disorders? I'm giving a broader spectrum.
Excellent question, and I'd again like to go back to something previously that you said, and then I'll come to what you have said just now, is that the reluctance in many families is around stigma. Because we are very scared in our society to say my child is different in any kind of way, because there is a lot of discrimination. We use terrible words to describe children and people who have a difference, and that is really where many families will have a reluctance to seek help. When they seek help, often what happens, and I think this is really important for families to understand, you said this earlier, this is not a cough, this is not a cold, this is not diarrhea. This is going to require time by the doctor to come to a proper conclusion. Of course, there are some disabilities which we can detect very early. So supposing you have a child who is not holding their head properly by 9 to 10 months, a child who by 18 months is not walking, a child who is got no speech, at 18 months, a doctor will very quickly be able to tell, if something is wrong, please go seek help. But for things like autism, we have certain tools. So we have certain checklists. We do observations on the child. So we ask the child to play with toys in a certain way. We ask them certain questions. We look at their responses. So this is a very important assessment that takes place, and it takes time. So parents must be not only patient with the assessment, but then I would say also patient with therapies, because these also take time. A child who has not been developing in the right trajectory or in the right way will require time to put them back on track.
Absolutely.
And that is what you talked about, which was early intervention. That how do we get them interventions early?
Absolutely. So, आमकां एक म्हणजे जशें हांवें सुरवातीक सांगलां की either we say that this is a pampered child, over pampered, or ignored.
Correct.
So either two, and they are in the bad community, bad company, and all that. So rather than putting this or labeling in this way, go to the depth of the problem, understand the problem, and guide the parents properly, because this is everybody's responsibility. See, this child is not just for one family, it's a child for the society and child for the nation also, and for the world.
Absolutely.
So we don't know how this child can be developed and what he can become. So don't underestimate. So as Khalil Gibran said, they are not your children, they are children of God. So as if they are children, that it is our responsibility to take care of the God's children. So one more important question, what do you mean by NDD and what happens in this? How you come to this status or conclusion of this?
So in terms of, if you come to me as a doctor, I will do a number of tests. And often I am not the only one doing the test. I will have a psychologist doing a test for thinking and reasoning. I will look at maybe the profile of social communication. There will be a speech and language therapist looking at the way they speak and they communicate. And then we will all get together and we'll say, okay, what is the best diagnosis for this child? When children are very young, particularly under the age of 6, we are a little hesitant about giving them a label or a diagnosis, because we know that if they get early intervention, some children might improve. They will often always have some difficulties, but they may not have a full-blown disability. So you might be able to support children to function better. I also want to say that a lot of neurodevelopmental and developmental disabilities are often because of the barriers in society. So let's consider a child who cannot hear. If everybody in their class knows sign language, this child is going to be completely included in their class.
Correct.
But what is happening in our society is nobody in the classroom can sign. So then we have to put this child in a special school. Supposing we had a child whose thinking was not, the child was 5 years and was sitting, was 5 years old, but was thinking at the level of a 3-year-old. If the teacher was able to adapt the curriculum and say, don't worry, people are learning numbers at this level, but I will give you a simpler worksheet. This child could still sit with their peers. So a lot of disability is because of environmental barriers.
Absolutely.
And I think it is for us as a society to think, how do we include all children? And I think you said something very, very important earlier, that society itself is enhanced when we bring people with a difference in.
Correct.
Because each of us can learn something, from a child maybe who doesn't speak. We can learn how they listen, because today we've forgotten how to listen.
Correct.
And a child who has intellectual disability, we see often are very, very affectionate. We can learn how to show our emotions,
Absolutely.
which many of us have now forgotten how to show emotions.
Absolutely.
So I think, how do we include children in society so that society itself is enhanced by their skills?
Absolutely.
Yeah.
सो डॉक्टरान सांगलो खूब महत्वाचो मुद्दो आशिल्लो की आमकां केन्ना केन्ना अशें दिसता की हाका एक गूण आसा पण हें ताका जमना, पण जो गूण आसा तो सुद्दां समाजा खातीर तो खूब कितें शिकयता, पण समाजाची दृश्टी तितकी आसपाक जाय ती शिकपा खातीर. सो इट इज नॉट जस्ट म्हणजे तो आमच्या खातीर एक टार्गेटेड ग्रूप असो न्हय की हाका हें जमना तें जमना, पण ताका कितें जमता तें खूब बऱ्या पद्दतीन जमता. जशें मॅडमीन सांगलां की ताका तो खूब अफेक्शनेट आसूं शकता, खूब मोगाळ आसूं शकता, तो लक्ष दिवन आयकता. आजकाल आमचें अशें आसा की आमकांच आयकपाक कोणा कडेन टायम ना, वी आर टू बिजी इन अवर ओन वर्ल्ड. अशा वेळार ही भुरगीं सुद्दां आमकां कितें कितें शिकयतात आनी हें शिकपाची आमची तितकी जापसालदारकी आसता. त्याच बरोबर शिकता शिकता तांकांय शिकोवपाची जापसालदारकी. इट इज आवर रिस्पॉन्सिबिलिटी टू लर्न एज वेल एज टू टीच.
Perfect.
So in this regards, another important question I would like to put, all these problems or disorders, are they for a long term to go or sometimes in a short time? I will not put temporary or permanent, but what is your say on this?
So most developmental disabilities are lifelong. They are lifelong conditions. There are few that we can overcome. So for example, hearing impairment. There are certain kinds of hearing impairment which now medicine has cochlear implants for.
Correct.
So if you detect a child very early, you put in a cochlear implant, this child will start speaking. So but those are very rare.
Correct.
I would say that most developmental disabilities are lifelong. It is how we intervene early and how we support this individual through their lives is what is going to make them productive and make our society inclusive and caring.
तर ही सगळी अशी दुयेंसां न्हय की मलेरिया टायफॉयड जशें की ताणें सांगलें लूज मोशन जाला जोर आयला खोकली आसा थंडी आसा गुळी 4 दीस घेतली 8 दीस घेतली 15 दिसांचो कोर्स केलो बरें जालें अशें जायना तर हाका एक पर्सिस्टंट एक सातत्य एक म्हणजे एक धीरय लागता यू रिक्वायर करेज टू फेस ऑल दीस आणि यू रिक्वायर अ सपोर्ट सिस्टम आणि ही सपोर्ट सिस्टम फक्त पेरेंट्स प्रोवायड करनात हांव परत परत ह्या खातीर सांगता की आमकां एक खूब संवय आसता की कोणाक लेबल करपाची तर समाजातलो प्रत्येक घटक हो आमचोच घटक आसता वेन वी से वसुधैव कुटुंबकम हे फक्त विश्व म्हजें घर अशें फक्त पुस्तकांतलें बरयल्लें वाक्य न्हय कारण हो समाज ज्या समाजान आमी रावता तो समाज जर सुदृढ आसलो तो समाज जर घटमूट आसलो तो समाज जर बरो आसलो जाल्यार आमच्या सगळ्यांची दिशा जी पॉझिटिव्ह आसतली आणि ह्या खातीर वी ऑल हॅव अ इक्वल रोल टू प्ले वी कॅनॉट से दीस रिस्पॉन्सिबल चाइल्ड ऑर चाइल्ड्स पेरेंट्स ऑर द टीचर हू इज टीचिंग हिम इन द स्कूल वर स्पेशल जे तांकां शिकयल्ले ट्रेनर आसता अशें न्हय तर आमचे सगळ्यांचीच एक जापसालदारकी आसता त्याच्या पद्दतीन तांकां समजून घेवप तांच्या पद्दतीन तांकां फुडें व्हरप आनी तांकां एक एनवायरमेंट अशें प्रोग्रेसीव एनवायरमेंट क्रिएट करप जातून आमी सगळेच फुडें वचूं शकता अँड ऑल ऑफ अस टुगेदर वील मार्च अहेड म्हणटा तशें Another, Madam, since we have got another 3-4 minutes, at this point of time, I would like you to tell us what are the things you would like to say in this regard because this is an important forum. We have got a lot of viewers, and this is what you are going to tell people. Definitely, this is an opportunity for them also to listen to you.
Absolutely.
So, what you feel important in this regard, right from your screening test or whatever you expect people to do, or where you feel people lag. Maybe since you have mentioned that this is a long-term therapy, but sometimes people give up. All these things can happen. So, whatever you feel like to be addressed. The scope is for you.
Great, thank you, Doc. So, you know what I would really like to say is one of the things we found very early in Sangath when we were at clinical services, the difficulty of families to come back. And so what we have been very determined to do is to create community-based resources. We are very lucky in Sangath now in Goa to be partnering with both the Directorate of Health Services as well as the Directorate of Women and Child. And we have launched a program a year ago called Namaste. Namaste is a very exciting program because we are going to be working in North Goa. We are going to be training all Anganwadi workers to actually recognize and screen for children with a disability. We have then given Anganwadi workers this calendar to give to children under the age of 2. And what this calendar will allow parents to do is to track their child's development. So what's very important is that though the maternal and child health card that's given to every parent when their child is born has these markers, parents are not using them well.
Absolutely.
So we are following immunization, we are following height and weight, but we are not keeping an eye on how our child is walking, how our child is talking. So that is an awareness we want to create. If you at all are worried, we are training your Anganwadi worker, so please go to your Anganwadi worker anywhere in North Goa and ask them, has Sangath taught you about how to screen children? There is a screening tool that we have taught them how to use. That information is then coming to the core team in Sangath, and we are providing 2 interventions again in the community. One is an intervention that is a group, so we bring a group of parents together, and what we then do is we teach them certain skills to support their child's development. And there is another intervention which is very autism specific. And that is going to be given at the homes of the parents. So we are very excited because this is the first time we are going to be in Goa delivering interventions where families live. Because we knew that this is one of the biggest barriers. When we had our center in Porvari, families would have to take 3 buses to come to us.
Absolutely.
You lose your wage, it's impossible. You know, after 2 sessions, you don't see much of a change and you say, I'll just manage at home.
Correct.
So what we feel in Sangath is let us take these very good interventions and give them in the community where families live. We are training up an amazing few Anganwadi workers to deliver these interventions. And what we're trying to show through this process is you don't always need specialists like me.
Absolutely.
You have fantastic resources in the community. If the government is willing to identify few people, they can actually transform the lives of these families.
So this is very important. जशें ताणें सांगलां की आयच्या ह्या घडयेक फक्त आमी एक्सपर्ट केलो आनी ताणें तो सारको करता अशें म्हणनासतना तांचे कडसून शिकून घेवप आनी हें सगळें आमी घरा इम्प्लिमेंट करप आनी ह्या भुरग्यांक बरो फुडार जावचो, तांचें बरें फुडार कार्य जावचें अशी अपेक्षा करतना सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामया, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःख भाग भवेत्। सगळ्यांचें बरें जावचें, सगळ्यांचें कल्याण जावचें, दुःख पिडा कोणाकच सोंची पडूं नये आनी अशें देवा कडेन मागून आयची कार्यावळ सोंपयतना एज यू सेड मॅडम, नमस्ते प्रोग्राम, नमस्ते.
Namaste.